Hi everyone. I am reviewing a article summary which is titled Missing and Misdiagnosis on the Autism Spectrum: Potential Consequences and Implications for Practice by author Glenys Jones. The article um, focused on 4 points. Um, it gave an overview of the diagnosed criteria of autism, also talks about the potential benefits of the diagnosis and reasons why diagnosed may be missed or misdiagnosed and possible consequences of the diagnosis. So, when someone is diagnosed with autism, um, there are two main focus points that you look for, and that's the lack skills of social communication or social interaction across multiple contexts, and also restricted and repetitive patterns of behaviors, interests, or activities. Um, Asperger is no longer separated and classified under the autism spectrum based on the DSM-5, and diagnostic labels alone is not enough to diagnose an individual, but a thorough assessment is required of their life. And the reason why, um, because there's no definite medical or genetic test that can confirm whether a child or an adult has autism. So you're basically basing your observation and assessment on their behaviors or their skills and also the history of their development from birth to present. So it depends on the expertise and experience of the specialist, and also what parents notice in their child's like signs and symptoms, and schools and staffs. Yeah. Um, for every male, for every 4 males, there's one female that is classified as having autism. And one of the reasons why that is females are more likely to receive diagnosed later than males. Also, the screening and diagnosis tools are based on a male autistic profile, so it's not really a female profile to determine what signs to look for in a female. And then also, females are more likely to master social difficulty. They're easier of coping with others, and they're more passive and quiet, and they tend to not disclose their problems to others. Um, and females' interests are more likely, quote unquote, to be normal than males, um, compared to unusual interests that males might have, and that's they might be obsessed with a celebrity or fashion or um, some kind of typical interests, and then where boys will have maybe obsessed with numbers or signs or things of that nature that brings attention to their defects. Also, the article touches on what are the consequences of not noticing the symptoms in females in a timely manner, and it could lead to some of these issues listed under, like self-harming behaviors, eating disorders, anxiety or depression, poor school academic achievements, or lack of social and emotional beings. So it is necessary to develop uh, and recognize signs in females to help lower some of these issues later in life. Um, some of the reason why it's hard of diagnosing or missing a diagnosis in autism, because autism tend to overlap with other symptoms and coexist with other conditions such as learning disabilities, ADHD, the pragmatic disorder, speech and language difficulty, dyslexia. Autism also coexists with other conditions like Down syndrome, cerebral palsy, hearing loss, and visual impairment. And it can be overlooked in school because a child may accelerate or in the academic, and a teacher might think, oh, they're genius or they're overachievers, and that just could be one of the signs that a child is diagnosed with autism, because where they accelerate intelligently, they might lack social skills. And as well, diagnostic confusion due to emotional and behavior traits, which a child can have difficulties in schools or family dynamic due to them suffering from neglect, trauma, or loss that they portrayed in their life. Some of the solutions to help with missed or misdiagnosis of autism is addressing methods of intervention. There's so many different interventions out there. It's just learning what's worked for one, and how to implement that. Also focusing more on the strengths and weaknesses instead of trying to change a child based on what they do, based on like stimulation or whatever. Kind of use that to their advantage, because that could be their coping skill. That could be the ways that help them calm themselves. Include autistic individual in the assessment and needs, like finding out what worked for them more, instead of just what the parents want or what the staff want or what professionals want, but what do the individual themselves want for their treatment. And it's good to know what you're looking for and how to detect it at an early stage, so you can start interventions early on. And adequate trainings in autism, whether it's professionals and teachers and other staff. Um, and the last slide talks about the consequences of what a diagnosis can have for an individual, which cause stigma in their life, label, and deny them access to opportunities in the community due to assumed conditions. And the potential benefits is it gives awareness to parents in schools and health and social service, that provides support by adjusting demands and environment, learn logic responses to situation, and appreciate their strength. You also have access to services, website, literature, support groups, interventions, and it gives a good mental health, whereas it's physical health and exercise, effective social support network, feeling successful, feeling purposeful based on the activities that you do. So these are a few resources that you can go online that speaks more about autism. And Autism Speaks, Autism Now, Autism Women's Network, Autism Asperger's.net, and Autism Internet Modules. Um, and these are the references throughout our PowerPoint. So thank you for tuning in, and I hope you enjoy, and looking forward to hearing feedback. Thank you.